Sometimes it can be difficult to determine whether there is local infection in a wound. So to differentiate between colonisation and local infection, there is a mnemonic NERDS and stones that we'll go through. I'll start with NERDS, and the mnemonic NERDS refers to colonisation of a wound. So what that stands for, N stands for non-healing. And we would say a wound is non-healing if it's not 30% smaller after 4 weeks. E stands for exudate, so an exudative wound or a wound that's developing more exudate. R stands for red and bleeding tissue, granulation tissue. D stands for debris. And the way you might see that, you might see devitalised tissue on the wound, like brown slough on the wound. And S stands for smell. So if 3 or more of these features are present, it suggests that there's colonisation of the wound, and you might consider using a topical antimicrobial therapy. Stones is the mnemonic that we use to determine if there's local infection. So what stone stands for is size is bigger, temperature. Now that's the peri-wound temperature. So if the temperature around the wound is higher than other areas of the skin, that's what that's referring to. O stands for os, the Latin word for bone. So if we can probe bone or see bone. N stands for new or satellite lesions. E stands for exudate, so increased exudate or heavily exudative wound. E also stands for erythema and edema. And S stands for smell. So you can see there's some overlap between NERDS and stones, but for stones, similar to NERDS, if there's 3 or more of those features, it is suggestive of local infection. And the more features that are present, the higher the sensitivity and specificity. So if someone has the 3 or more features of stones, we need to suspect local infection and think about the need for systemic antibiotics.